my name is Audur. It's really hard to pronounce my name, so you can call me Audi. But I come from Iceland, from Reykjavik City, and I work at the Welfare Department for the municipality, where we are digitalizing our entire welfare services one step at a time. We've been mainly focused on home care for now and implemented some solutions there and really seeing the impact of what HealthTech can do for people, elderly people that want to stay at home. So,
amazing.
Yeah.
And before we get into that, because I'd love to hear what you guys are doing and having been at Confed last week and hearing what they're doing in terms of neighbourhood care in the UK and then what we're sort of looking at doing in Australia as well. But I'd love to hear, reading your bio, we have a similar starting point, both started as nurses and now you're leading digital health transformation at Reykjavik. Can you tell me a little bit about your journey and how you ended up in the role you're in now?
Yeah, so I'm a nurse and I worked at the hospital for quite some time in oncology care. And, it just kind of frustrated me how, we are not that far along with using technology to ease up our jobs and constantly just running faster and unnecessary steps that you have to take, which, you could automate or use some sort of technology to help you do it. So I was really kind of improvement focused in my job and I was trying desperately to improve the way we worked at my department. But, it only got me so far and I felt I didn't have the tools or the knowledge to really take things further. So I went to Copenhagen to study business and innovation in healthcare. I did my master's there. I learned a lot, and from there I worked at Philips, and then a startup in Iceland called Sidekick Health, and then it's really fun to work at these companies that are making the technology. But for me, my passion kind of lies with working with the people and public service. So I went to Reykjavik City and worked there, and I've been now for the last 2 years building up a team of professionals that are using technology to provide care. So, that's kind of where I'm coming from.
Yeah, amazing. And I loved having a read of sort of what you guys are doing, and maybe we could sort of start diving into that sort of that intersection of that community care and I guess the challenges that come with that. We're experiencing it the world over, but certainly like the workforce, and then how do we bring care back into communities and keep them out of those acute services? Yeah. Can you tell me a little bit about what you guys are doing?
Yeah, so we've been thinking about, before I started at Reykjavik, they had been looking at all sorts of solutions they could use to for the home care especially, and that's been like a 10-year journey, but they started testing solutions that are more maybe aids, to help people, no service attached to it. So we kind of started to focus on technology that are providing some sort of service, that we are monitoring something or providing care via the technology. So before COVID started, we had been preparing for implementing video visits to kind of mainly for maybe people are socially isolated and lonely at home, to have someone there on the screen. We didn't need to drive as much, but then COVID hit and we just needed to start implementing it, and it was really kind of what escalated us doing so. But since then we have implemented video visits and automated medication dispensers, and we recently completed a pilot project for remote monitoring for heart failure patients, and are preparing to procure and implement that solution and scaling it up.
Yeah.
That's the real challenge. And then also we have recently implemented remote rehabilitation for older individuals living at home. So we have a centralized team that works for all the districts in Reykjavik that it's providing this care. And currently we have nurses, social aides, and nutritionists and a sports therapist. And they kind of all work together to help people stay independently longer at home. And we've seen some great results from using this technology to help people, and they're really happy about it. They even think it's sometimes, many of them, that it's a better service than having people come to your home. So that's really nice to hear.
Yeah, someone said to me the other day, reframing the way we do healthcare and doing it from the idea that you come into a service as virtual, and then if you get to stay at home, and then if you're unwell enough, then you get stepped up into an acute bed and the hospital, and then if you're unwell again, well, then I guess the ceiling of that is ICU. But having that frame of mind that your first instance with the healthcare system is within your community, it's you're at home and you're getting those services that you need. What are some of the challenges you guys have seen in?
Yeah, a lot of challenges. But we have been trying this, changing the mindset to this digital first approach, because I believe that even if we get them into home care a little bit sooner, we can keep them more healthy and for a longer time, and they don't need as much service later on. Or even if we can just delay it by 6 months or something, it will really help, because we're so short on staff. It's like the main challenge, and we just need to utilize the workforce that we have way better than we do now. And I think with technology we can do that, because I like to say, like, we can't hire our way out of this problem that we have. We have like a huge gap between that demand and supply, and it's only going to grow if we don't do anything. And I think technology is one of the elements that we need to kind of use to shrink this gap. I don't think we maybe can never fully close it.
No.
We can utilize each resource we have way better with technology. But getting the workforce to change this mindset about, using a digital-first approach, because they have been, many of them, working a long time in the system, and they're like, why should I stop visiting and put a screen? They don't realize. And because I have clearly seen the impact and how we can really provide as, good as a service with technology as in-person visits. And then we can utilize the in-person visit for people that really, really need them. And I think that is high-value care. You use it when they need it, but not just as like a scheduled visit. They're maybe fine that day, but later in the week they might really need it. So I think that there you can, really utilize it better.
And have you found any keys in being able to unlock that mindset with the staff? Because I know, like, finding the tech and having the tech there ready to go is only one very small part of it. But being able to change those attitudes and the ways of working and embedding that change, what have you found in that space?
So I think because we run the centralized team and the reason why we centralized it, because we tested, putting the screens, in each district, so the workers that would usually go to people's homes were just trying the video visits, but it didn't work because of the mindset. So we decided to centralize it in one team to build up, knowledge and how we can really work with technology to provide the service. And now it's been, almost 5 years that we have had this specialized team doing that. And it's really now that we're seeing like the light bulb moment. And they're like, they're realizing, we can't hire more people. We need to do something different. And I think it's coming now, 5 years later. It takes time.
It does,
and you just need to be like a parrot, like saying the same things all over again and just reminding them what it can really do. So, I think now is the light bulb moment that we've been waiting for, and we just need to keep going. But now it's more also... we've built the infrastructure and the knowledge of how to provide the service with using technology, but now we really need to scale it up to get more users, because we have done analytics on our user group, but how many could be, for example, put into remote care with long-term illnesses. And we found like 40% of the home nursing could actually go into that service, not maybe only remote monitoring, maybe some other things as well, but I think... it is 40%.
It's huge.
It's huge. And now we're maybe touching 2-3% of our user group. So it's like huge gap there and a lot of opportunities. So I'm really excited for when that happens.
So the next phase. So in terms of now and then where you're headed with this next phase of scaling, what's success going to look like in there?
I think we are going to support people better. I always try to, think about it from the user perspective, not the institution. Of course, we want to think about how we can use our resources better. But I think if you go it from the user perspective, you are also going to use your resources better.
So important to work back from the user, the patient.
So when we scale, I think also you can see like the efficiency in the services. But I think that the people will appreciate this type of service more because it's giving them more independence. You know, they're not like, you know, no one wants to be in a place that needs someone to help them in the bathroom. And they want to do it themselves, right? So, you know, changing their mindset as well of how they perceive services. I think that is what,
And, you know, you still have a long way to go. Like 3% to 40% is not something that you can change that overnight.
No.
And a lot of that is bringing the workforce that you have along on that journey with you.
Yeah.
It's working with those that are entering that phase of their life and showing them how they can be wrapped in your service and have that longer time at home, being independent before they have to rely on home care or aged care facilities.
That's true. I'm really excited for when we, you know, reach that scale, because then we really can see the benefit from it. So, now we're just like touching it a little bit. But what I am missing is kind of like, because I don't control the money, or the investments, but I'm kind of looking for, I want to see us setting a goal, like saying in 2030, we want to have 40% in this kind of service or something, so we can just say to the workforce, like, this is the vision that we have, we're heading there, and it's not just something we're testing. It's not like a side project. This is we need to focus on.
We're going here.
And I'm missing kind of in Iceland, like this, the kind of a national strategy for this type of service. Now I feel like the government doesn't know what they should do with it. They know, like, innovation, technology, it's nice, but how are we going to use it? Because if we don't start now, we're going to be too late. We're already seeing the problems and the challenges, and we need to start now. And we lack kind of like a long-term vision for the whole country, because we are a tiny country.
Yes.
I'm just like, if we can't do it, like, tiny as we are, like, come together and work together, like, across organizations. Who can do it then, you know?
Oh, absolutely.
And I also, like, we're a small country. We'll never have the best health system in the world, but I want to, like, set us a goal that we will be the smartest one, you know?
Yeah, and you're doing the best by your people, and that's so important.
Yeah.
And I think if we're measuring how good a health system is by the quality of the people within that health system, then perhaps you do have one of the best ones.
Yeah,
maybe. You can aim to have one of the best ones.
But it's just amazing to see. You know, I'm so thankful for where I work now, because I can really see the impact, and in the user stories and talking to the user about how this has helped them. And I want to share some of them, because, like, in the remote rehabilitation, we are using a Swedish solution called Happy, and it's like a tablet and like a digital coach that helps people train at home, and they don't need anyone present there to train. And we can follow up with that. And there was this one guy who was stuck in his apartment on the 3rd floor. And he had, it's been weeks since he went outside because he couldn't manage the stairs. And he went into our program, and he's been now for 8 months, I think, and completed over 500 sessions by himself. And now he walks up and down the stairs and even walks to the store, like the longer route, just because he can. And I think this is what, like, kind of keeps me going, hearing these stories, how we can, really changed, and he feels so empowered because he did it himself, using our support, obviously, but he did this. It's like, it's not us, it's him.